Hi everyone, my name is Shakifer Bouyan, and today I'm going to be showing you guys how to perform CPR on an adult for my demonstrational speech video. I'm sure that we've all seen CPR being done, or at least have an idea of what it should look like. Whether this be in situations such as actually witnessing a cardiac arrest, or seeing shows such as Grey's Anatomy, we've all seen some sort of CPR being done. Today I'm going to be able to show you guys how to perform CPR on an adult, the proper steps that you should take prior of performing CPR, some tools that could be used, and also some tips that I've learned as an EMT and how they can help perform CPR better. CPR, which stands for cardiopulmonary resuscitation, is a life-saving technique useful in many emergency situations such as a heart attack or breathing emergency. It is a combination of chest compressions, and artificial ventilations used to help keep oxygenated blood flowing to the brain and other vital organs. When the heart stops beating, lack of oxygenated blood can cause irreversible brain damage within a few minutes, and within 8 to 10 minutes, death. However, after watching this video, hopefully you'll be able to prevent that and will help increase a patient's chances of survival. It is actually estimated that between 100,000 to 200,000 lives of adults and children each year can be saved if CPR were performed early enough. Okay, so now you find yourself in a situation where someone is laying down right in front of you on the ground and is unconscious or has recently had a cardiac arrest. What do? The first step that you should take before performing any form of CPR is to make sure that you yourself are safe. Inspecting the scene for any potential hazards such as chemical spills, gaseous fumes, or electrical wires is very important. Remember, you must also make sure that before trying to help anyone that you yourself are safe so that you don't become a victim. After ensuring that the scene is safe, tap or shake the victim to see if there is any response. If there is no response, check if the patient has a carotid pulse. This is done so by placing 2 fingers to the patient's neck. If there is no pulse, we will inspect if the patient is breathing. This is done so by looking at the patient's chest and abdomen and looking for chest rise and fall. If there is none, we will make sure to tell someone to call 911 and that they bring an AED. This will be helpful in later steps. After so, we will also tell the person that they make sure that they come back and that they help us out. After ensuring that the patient has no pulse and is not breathing, we will begin compressions right away. This is done so by placing the heel of the hand between the chest of the person, right on their sternum. We have to make sure that it is not too low where it is on the xiphoid process, or else the little bone in here will protrude into our organs, which is not what we want. So after placing your palm of your hand in between the patient's sternum, we also place the other hand right above that hand and interlock your fingers, making sure that you provide an accurate seal. Locking your arms and placing your shoulders above the person, you want to compress 2 inches deep. Doing so will help perform adequate chest rise and fall, making sure that the heart releases enough blood and also refills with enough blood. After providing 30 compressions, what you want to do is provide 2 breaths that are for 1 second each. This cycle is done 5 times. If no one arrives in 5 cycles of compressions, what you want to do is call 911 yourself and tell them to get call 911 yourself and try to get an AED. Delivering a shock through the AED machine is very important to reorganize the heart's sinus rhythm. So there you have it. I hope you guys enjoyed this video and was able to learn the proper steps of performing CPR. Remember, our first step is that we should always make sure that our scene is safe. Our second step is to inform someone to get an AED and to call 911. Our third step is to check if the patient is responsive. If they are not responsive, we want to check the patient's carotid pulse and to check if they are breathing or not. If no pulse is present and if they're not breathing, what you want to do is start compressions right away. This is done in a cycle of 30 compressions that are 2 inches deep and allows for full chest rise and fall. After performing 30 compressions, we want to allow 2 rescue breaths. Rescue breaths are given for 1 second each. And then, after 5 cycles of this, if no help arrives, we want to call 911 ourselves and to get an AED. So there you have it. I hope you guys had a great time watching this video, and I hope that you guys have a great day. Thank you.